Welcome to our webinar. Bienvenidos. In the name of the National Latino Behavioral Health Association and the National Hispanic and Latino Prevention Technology Transfer Center, we welcome you to today's webinar titled, Life is Precious, a community-defined practice suicide prevention program for Latinas adolescents. This presentation is the third session of a four-part webinar series titled Institutional Racism and How It Impacts the Latinx Experience and is related to behavioral health, in collaboration with the National Hispanic and Latino Mental Health Technology Transfer Center and the National Hispanic and Latino Addiction Technology Transfer Center, in celebration of the Hispanic Heritage Month, which they place every year for September 15 to October 15. My name is Dolca Michelle Zelaya. I am the program coordinator for the National Hispanic and Latino Prevention Technology Transfer Center. I will be your host for today's webinar. Before I introduce you to our guest presenter, here are some brief instructions about today's webinar. The webinar will be recorded and archived for future playback. It will also be recorded in Spanish and Portuguese and posted on our website. A copy of today's presentation will also be available a few days after this webinar. The lines will be muted throughout the presentation to minimize some background noise. When we get to the QA portion of the webinar, you will have the opportunity to ask questions to the presenter by clicking the QA box. We will be also asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work we do and provide us the opportunity to improve our training efforts. Although we not secure continuing education credit for this event, we plan to do for future events. Instructions on how to obtain a certificate of completion will be emailed to you after this event. Let's start by introducing the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit organization located in New Mexico. The mission and goal of the National Latino Behavioral Health Association is to influence the behavioral health policies, eliminate disparities in fundings and access to services, and improve the quality of services and treatment outcome for the Latino population. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and adequately trained personnel. NALBA's executive director is Mr. Fred Sandoval. Our objective is to provide national leadership on mental health and substance abuse concern of the Latino population. NALBA's policy priorities are targeted capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of counselors, therapists, and other behavioral health practitioners, fundings for co-occurring disorders on alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. Now, allow me to introduce you the Prevention Technology Transfer Centers. Our PTTC is part of the TTC network, a multidisciplinary resource for professionals in the prevention field. The PTTC network was established in 2018 by the Substance Abuse and Mental Health Service Administration, SAMHSA. The PTTC network is comprised of 10 domestic regional centers, 2 national focus area centers, and a network coordinating office. Together, the networks serve the 50 US states, the District of Columbia, Puerto Rico, the US Virgin Islands, the Pacific Island of Guam, America's Samoa, Palau, the Marshall Islands, Micronesia, and the Mariana Islands. Our center has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Our PTTC is staffed by Dr. Pierluigi Mancini, our project director, Priscilla Giamasi, our executive, administrative, and assistant, and I serve as a project coordinator. Now it is time to present our esteemed presenter for today, Dr. Rosa Gil. Dr. Rosa Gil is the founder, president, and CEO of Comunilife. Dr. Gil has a distinguished career in New York City, health, mental health, supporting housing, social services, and higher education sectors. Comunilife opened in 1989, and Dr. Gil has centered the work of the intersection between health and housing with the goal of addressing the critical social determinants of health and enhancing the health outcomes of New York City's underserved communities. Dr. Gil's leadership's Comunilife has developed more than 2,177 units of affordable and supported housing for the city's hardest to reach residents, the homeless, mentally ill, and people living with HIV and AIDS and other health conditions. Under her leadership, Comunilife created Life is Precious, a national recognized program for Latino teens who have seriously considered or attempted suicide, and also created the city premier Medical Respite Program, working with two New York large cities, private hospital systems. The Medical Respite Program was expanded during the peak of the COVID-19 pandemic to provide short-term housing for homeless and unstable house New Yorkers who were hospitalized due to coronavirus, but required a location in which they quarantine while completing their recuperation. Dr. Gil, what an amazing work that you are doing. We are very happy to have you this afternoon with us. Welcome, and thank you again for accepting our invitation. Please, you can start your presentation.
Buenas tardes. Good afternoon to all the participants in this very important webinar. And I'm delighted here to present the Life is Precious program, which is a very unique program at Comunilife as well as the city, the state, and the country. Next slide. So we really are deeply appreciate the invitation from the National Latino Behavioral Health Association, NELVA, and the National Hispanic and Latino Prevention Technology Transfer Center for this invitation to participate in this third session of the series entitled Institutional Racism and How It Impacts the Latinx Experience as it relates to behavioral health. And I'm delighted to hear that there's another session next week. So let me tell you a little bit of who we are. Comunilife, like Dolka mentioned before, was founded 31 years ago as a nonprofit health and human services agency. And our mission is to provide vulnerable communities with housing and culturally sensitive supportive services. And our vision is that no one, and let me repeat again, no one should be without the housing and support they need to lead a healthy and meaningful life. And as mentioned before, each year, our rich continuum of housing and services meets the need of more than 2,600 low-income and vulnerable New Yorkers. Next. So what do we do? So we offer more than 2,000 units of affordable and supported housing like Dolka mentioning. The populations that we really focus on is individuals with chronic illnesses, such as HIV/AIDS, mental illness, and others. And also for New Yorkers who are of low income. And in 2008, we opened Life is Precious, which we believe that is an innovative suicide prevention program, which is the topic of my presentation today. However, before I move on to the actual presentation, let me tell you a little bit about the key concepts that are underlining the presentation of this program and actually the program itself. Next. So a key concept is race. Race really in anthropological, cultural anthropology, race refer to a group of people who shares certain inherited physical characteristics, such as the skin of the color of the skin, facial features, stature, and although race is a social construction, what it means to be Black, white, or Asian is determined by culture. Race has a real consequences because the racial categories, again, Black, white, yellow, or Asian, were invented for the sole purposes of reinforcing inequalities. I just will mention that we don't have a category in cultural anthropology for brown, which now we often use the term brown people. So that's race, but then what is ethnicity? Why is ethnicity important to the work of mental health for Latino community? Well, ethnicity refers to shared culture such as language, ancestry, beliefs, norms, and practices. Individuals in some groups are treated differently because of religion, because of the cultural norm, or because we don't speak English. And that leads to inequality. Next slide. So another important concept here. What is equity? Because often we talk about equity and equality. So let's put this term into context. Equity is ensuring that everyone has the same opportunities and receive the same treatment and support. It is about giving people what they need in order to make things fair. It is not the same as equality, nor it is not the same as inequality. It is simply giving more to those who need it, which is proportionate to their own circumstances, in order to ensure that everybody has the same. Meaning that if you only speak Spanish, then we do have an obligation to have bilingual staff in mental health to be able for those patients to receive quality of services in their own language. So again, what we are doing is an action to bring the Latino non-English speaking to be able to receive diverse services. So equality is defined as treating everybody the same and giving everyone access to the same opportunities. The difference though between equality and equity really needs to be emphasized. Although both concepts promote fairness, equality achieves this through treating everyone the same regardless of need. That is equality, treating everybody the same regardless of what your needs are. While equity achieves this through treating people differently depending on the need. However, this different treatment or action may be the key to reaching equality. So in Life is Precious, the intent is here to create equity with a tailored intervention for immigrant Latina adolescents at risk of suicide and their non-English speaking family. It means that they need and receive extra support, though creating an equal opportunity for receiving best care as others do. If equality is the end goal, equity is the mean to get us there. Next. Last but not least, in terms of concept, behavioral health disparities. These sources of racial and ethnic behavioral health disparities include difference in geography, lack of access to adequate health coverage, communication difficulties because of language between patient and provider, cultural barriers, provider stereotyping, and the lack of access to providers. Next. So now let's focus about the Latinx population, primarily here in New York City and New York State. But my presentation today is really focused on New York City. So we know that 17% of the US population is Latinx, 19% in New York State, and 20% in New York City. Next. The New York City Latinx, we are cultural and racial diversity of Latinx in New York City reflects more than 20 distinct different heritage groups of indigenous, African, and European ancestry. 42 of all Latinos in New York City are foreign born. That's an important point. Remember, 42% of Latinos in New York City are foreign born. 80% of Latinos ages 5 and older living in New York City, they speak Spanish at home. So we are keeping our language. And of those, 53 speak English very well, but still they like to speak Spanish at home. Next. 35% of New York City, 1.7 million children are Latinx, the largest of all ethnic group in New York City, racial and ethnic group. 40% of all children living in poverty are Latinx. What a shame, isn't it? 48% of all children receiving mental health services are Latinx. 58% of all children living in immigrant family with one or more foreign-born parent. Next. So the undocumented Latinx population, we know that there are 11.2 million undocumented in the country. There are approximately 500 undocumented immigrants living in New York State, although a word of caution, you and I know, above all of us know, that that may not be the reality, that there may be many more that have not been counted. And it is estimated that 62% of all undocumented immigrants in New York State are from Mexico. Next. So Latina adolescents and suicide and mental health inequality. Next. So in New York State, suicide is the second leading cause of death for Latina teens. You heard me right. This is the second leading cause of death for Latina teens. Every 2 years, the Center for Disease Control issues a report on high-risk behavior among the country high school students. The latest CDC report was released in August of 2020. The CDC report states that Latina teens have higher rate of suicide behaviors in comparison to other African Americans, Asians, and white adolescents. I want to focus on two particular indicators in the report. One is the incidence of adolescents seriously considering suicide, and the second indicator is attempting suicide. Next. So here we go. Let's just focus first on one other indicator, which is felt sad and helpless, to the point that they stop doing their usual activities 2 or more days in a row. In the United States, CDC shows that 50% of Latina adolescents in high school are feeling sad and helpless. New York State, 45%. And look at New York City, 47.10. In New York City, let me just clarify, in New York City, we have 5 boroughs or counties. In the boroughs with the highest percentage of Latinas who have felt sad and helpless were Manhattan, 52%, which is even higher than the United States, Staten Island, which is another county, another borough, 51%, and Queens, 48%. Next. What about the other indicator? Seriously considering suicide. The United States, we have 22% of Latino adolescents in high school who are seriously thinking about killing themselves. In New York State, we have 17%, and in New York City is 18%. Again, the boroughs where we have the highest percentage of Latina with seriously considering suicide, Brooklyn, 21.20. Look at that, close to the United States. Manhattan, 20%. Bronx, 18%. Next slide. So attempt suicide, here we go again. United States, 11.9, New York State, 10, and New York City, 10. And in terms of the boroughs with the highest percentage of Latina teens in high school attempting suicide were Staten Island, 13% above the United States, the Bronx, and Brooklyn. Next slide. So why is this happening? By the way, this is happening according to Surgeon General studies. This has happened since 1995, when the CDC began to really do the studies of adolescents in high school. We do know that Latina adolescents through the years has experienced an extraordinary challenges in terms of suicide behaviors. So why is that so? Well, let's think about it. First of all, we are all teenagers, and teenagers do have universal factors that impact that important stage of development in our life. But universal factors that do impact the Latina adolescents include poverty, disadvantaged neighborhoods, issues of self-esteem, body image. But what is unique? What are the risk factors? What is unique about the Latina at risk of suicide? Well, the literature, and Dr. Luis Saya is a main researcher in this area who have been for years looking at this challenge. Acculturation stress. And acculturation stress, we all know because of the literature in anthropology as well as psychiatric literature, that basically it is the difference of in adopting the norms and the language of the country, meaning that in the case of Latinos or Latinx, we know that the children acculturate much more faster than the parents. And that is not only around language, it's also around norms, belief, patterns of behavior. Remember that earlier I told you about ethnicity, right? So I'm now beginning to connect that to how important it is to think that norms and behaviors are different from one country to the other. The other important factor is dysfunctional families. And regretfully, this is happening in our communities, and there are challenges. For example, just a couple of days ago, some of my colleagues in the Life is Precious were telling me a referral of an 11-year-old who witnessed the murdering her father. And these are, of course, traumatic experience for that 11-year-old adolescent and the family. But, there are many issues around dysfunctional family that really are contributing factor to the stresses of Latin adolescents. And then, of course, the conflict about family members and parental divorces, that is another important factor here. Familism. Remember, this is key to the Latino community. Actually, the United States, basically is more an individualistic in terms of value, cultural values, individualistic and competitive society, while our countries are more familistic, more family-oriented. And we all know how important the family is in our life. But outside for the family, the peer social networks, the bullying that we have seen increase through the years, the emotional isolation, and we see that in our program. You know, the mothers try to work, the girl come home and she's not there, and you know, there's not that much going on because of the stresses of the parents to have to work. Another risk factor is drug or drinking problem by the girl or family. And then last but not least, which is important, is sexual and physical abuse. Now, in the days that we're living, there are new risk factors for the Latino adolescents at risk of suicide. And that's the vilification of immigrant and Latinos, Latinx in particular. The fear of deportation and COVID-19. Next. So Dr. Saya has pointed out that there are some triggers that we have to be aware of. And those are events occurring shortly before suicide that the girl said is accurately related to the suicide attempt. Most common is relational conflict with family members, sweetheart friends, and friends or close person. An emotional experience is difficulty dealing with complex feelings, escalating or of frustration and tension. And those are some of the triggers that have been presented in the literature. Next. So life is precious. So why do we do this? Well, in 2005, you know, we saw in our outpatient mental health clinic, the Vida outpatient mental health clinic in the Bronx, we saw an increase in the number of referrals of Latino adolescents who were presenting suicide behaviors. And we were concerned, so we, of course, turned to SAMHSA to look for the best practices and look at the best practice registry by SAMHSA in 2006, 2013, or in the Suicide Prevention Resource Center, which addresses the unique challenges faced by Latino adolescents. We didn't find any in 2006, we didn't find any in 2013, we didn't find anything in 2020. This highlights the mental health research inequality and neglect of the Latinx community. SAMHSA, of 44 studies of suicide prevention program serving youth from 1980 to present, only 3 show any decrease in suicide thought, and none were tailored to interventions to Latina teens. Next. So what were we going to do in 2005? So we began to really talk to colleagues, explore the literature, and then we saw the increasing concern in the literature about community-defined evidence. And what is community-defined evidence? Well, this is a set of practice that community have used and found to yield positive result as determined by community consensus over time. In other words, these are the things that happen in our community that the community feels that it works, that it addresses a problem, and there's a community consensus about it. These practices may or may not have been measured empirically, which is the whole point of evidence-based, right? But have reached a level of acceptance by the community. And we got very much concerned about this and interested in community-defined. Next. So not only I'm presenting here and delighted to be presented at NELVA, but we do have a history with NELVA. Comunilife was one of the Hispanic agencies to participate in the Community-Defined Evidence Project. This was a joint initiative between NELVA and the National Network to Eliminate Disparities in Behavioral Health in association with the Department of Child and Family Studies in the Luis de la Porte, Florida Mental Health Institute at the University of South Florida. And actually, Life is Precious is based on the principle of community-defined evidence. Next. So what did we do? So we went to the State Office of Mental Health, which is the mental health authority in the state, and we told them, you know, there is an increase in the number of Latinx adolescents coming to the clinic, and we need to do something. And we were able to get a little bit of money to do a qualitative marketing research, to go to the community and find from them what did they think it was the problem that we had so many Latina teens showing in emergency rooms and the clinics exhibiting suicide behaviors. So we were funded, and indeed we did have a qualitative marketing research in the South Bronx. the parents told us basically, and especially the Latina adolescents told us, listen, you have to be concerned about the fact that the schools and the mental health clinic doesn't really understand us and our parents and the culture. So we asked them, you know, what did they think that we could do to help out? And they told us, create a center, which is a safe center where the Latina teens can come and express their feelings and in a safe manner. And, you know, they even told us what to do in the center. They said, you know, please make sure that you have tutors that is going to help them with the school work, because when they fail and they don't pass grade, they feel awful. So they told us basically, you know, and they make sure, and they said, make sure you have one of your staff helping the mothers, because the mothers doesn't understand that this is a different country, that they think that they continue to be in Puerto Rico or in Dominican Republic or in Ecuador or whatever. So they really basically told us, you know, program design in a way. And, you know, we thought that we were listening from the community in terms of community define. And then we began to take steps to, number one, create basically an awareness in New York City that we really had an epidemic, a challenge with Latina adolescents at risk of suicide. And we had editorials in El Diario La Prensa, which is was the major Latinx newspaper in New York City, where 3 articles were published. We had an editorial in the New York Times, and we began to create in the community a concern about this. But then we went to the elected officials, to the chair of the Senate, the Assembly Committee, the New York State Assembly, that has a mental health committee, and the chair of the mental health committee in the city council. And we asked them, hey, you know, you are the policymakers, you are the elected officials, so what are you doing to really help the Latino adolescents at risk of suicide? To my surprise, they look at me and say, oh, we didn't know. I said, well, now you know. So now what are you going to do? So we began to, as a matter of fact, as a result of that, we did have a public hearing sponsored by the Assembly, where the State Commissioner of Mental Health had to come and testify on this issue. So we were on the papers, we were talking to elected officials, and we did have the design of a program, and New York Community Trust, which is a foundation here in New York City, called me up and said, you know, we never knew about this problem, but we have money, and we would like you to start a pilot program to address the need of Latina adolescents at risk of suicide in New York City. And that's how Comunilife, that's how Life is Precious was developed, with a philanthropic response. There was other foundations that came forward and helped us to have the first center in the Bronx. These centers operate, you know, after school, and I will talk a few minutes about what we do in the centers. And we opened the center in the Bronx and later on in Brooklyn, Queens, and Manhattan. For example, this year, we have already 123 Latinas that have been referred to the centers, and 84 currently receiving services. And more than 300 Latina teens have participated in Life is Precious since it opened in 2008. Next. So what is the criteria for admission? Well, the Latina teens have to be the ages between 11 and 18. They must have a psychiatric diagnosis. They must be in treatment in a mental health clinic, not necessarily the Vida Mental Health Clinic only of Comunilife, but any mental health clinic in the city. They must be in school, and we require parental consent and participation. Next. So the program activities, we provide case management services. We have youth development groups. We create art therapy, creative art therapy. And I'm going to talk for a second on civic engagement in a minute, but I want to talk about academic support, who help the girls with doing well in school and actually preparing them for college. We have wellness activities, and we have a lot of family support and activities and school advocacy. So what is this about the civic engagement? Well, you know, actually the day that we opened in 2019, the center in Manhattan, I said one of the girls from the Queen Center invited me to have dinner at the center. And I said, gee, with that day I cannot do that because I'm going to Albany to advocate and get funding for this program. And she said, well, can we go with you? And that created a question in my mind, gee whiz, you know, maybe we can help them to understand how government works and to begin to advocate for themselves and others. From that idea of one of the program participants, last summer, not summer 2019, the girls went to Washington. They met with Congress people, congressmen and senators. They have been in the state assembly and Senate. And they are quite, you know, we have been teaching them about the role of government and participation in this effort. Last but not least, let me tell you about the Ni Una Más campaign, and that not even one more to prevent Latina adolescents. And this campaign was developed in Washington Heights, which is a neighborhood in the borough of Manhattan. Next. And the reason why we did that is because we needed the community to know what's happening to Latin adolescents. And you see, La Esperanza llegó a Washington Heights. Hope got to Washington Heights. And we have this public campaign has really helped to identify the Latina teens at risk of suicide in that particular neighborhood. We have it in buses and we have it in the streets, in the stores, so far and so on. It has been a very effective public campaign, public awareness campaign about suicide among Latina adolescents. Next. You may ask, well, you know, how do you get funding? Well, we never were able to really get funding from the State Office of Mental Health because we were not an evidence-based practice. So what we did 3 years ago, we, in partnership with Columbia University, New York State Psychiatric Institute of Excellence for Cultural Competence, we began to have a program evaluation because we do want to know. I mean, we can tell you internally, you know, that actually, you know, we haven't had completed suicide of any of the girls participating in the program, but really we wanted scientific evidence that this works. So the questions were, does the program reduces suicidal thoughts, suicidal ideation? What works in this program? Can the program be replicated to other settings? Not only in New York City, can it be in the rest of the state? Can it be in Florida? Can it be someplace else? Can life is pressure be determined to be a community-defined evidence-based practice? Next. So we had a lot of questions, and we get funding from, again, Community Trust, provided the funding for the research aspect of this program, and we have ongoing quantitative and qualitative data collection. We already finished phase 1 activities, which is finalize the LIP manual, the fidelity, and training materials to enable to disseminate this program to others. And we are currently now on phase 2, which is we have 3 mental health clinics where we have control groups. And, you know, hopefully by the end of, or in 21, we will be able to analyze the data from the control groups, as well as the continued participation of the Life is Precious participant. Next. So we have examined the suicidal thought and depression symptoms and family function in terms of the research. And these are the measurement instruments that we use. And this program already, you know that what we try to do is really to try to incorporate aspects of the culture, and we're focusing on family functioning and the presence system. So We are using the Suicide Ideation Questionnaire, SIC, Reynolds Adolescent Depression Scale, Trauma Symptom Checklist for Children, and Family Cohesion. So these are the 4 instruments that we are using in our research with different measurements that will really be helpful once we have the findings and the comparison with the control group to really get an idea or really a better understanding of what this challenge for Latino adolescents are next. What do we know already through the work of the research? Well, we know that there is a statistically significant, although small, there is a change in suicidal thoughts and depressive symptoms. In other words, it has been a reduction. And the researchers' preliminary findings show that for every month Latina teens participate in the Life is Precious program, her level of depression and suicide ideation does decrease. This is especially true for teens with history of sexual abuse, tobacco, or alcohol. And I just want to underline this because you remember that I mentioned in terms of contributing factor, the issue of community, family functioning, as well as the history of sexual abuse, physical or sexual abuse. And I think that we in the mental health field, as we work with our patients, this is something that is important, obviously, always to pay attention to, but it seems to be an important factor in considering the suicide attempts of Latina adolescents. Again, as I mentioned before, there have been no completed suicide among program participants, and we have had over 300 participants since 2008. Of course, our research has limitation, meaning that there's no comparison group. The result of the control group is not ready yet. It's in process in the second phase. The data collection is only during the participation of the girls in the program. And of course, in the control group is the same thing, while they are receiving mental health clinic in the mental health clinics of the control groups. So basically this program doesn't have, a longitudinal way of measuring whether the evidence of progress sustained through years or months or whatever. We don't know what the improvement is maintaining after they leave the program. And the current locations are in urban areas, like I mentioned before, New York City, in the Bronx, Brooklyn, Manhattan, and Queens. So the question is the same phenomena in the rural areas where Latina adolescents at risk of suicide lives, as opposed to the urban areas. And now that I'm talking a little bit about the different locations, which are the Bronx, Brooklyn, and Manhattan, I think that it's important to recognize that there is one borough in New York City, which is Staten Island, which you saw in the early slides that I presented, that do have high evidence of Latina adolescents in that borough who are experiencing, who have suicide. They're feeling depressed, they're feeling suicide. In other words, they're thinking of seriously completing or committing suicide, and then suicide attempt. That borough, we don't have an office yet, or a center. And that actually leads me to the point why is it that we don't have a center in a borough of Manhattan, in the borough in New York City, that really shows a need of the Latina communities there? Well, the reality is that the funding of this program to open a center, we have to have funding, of course. And the State Office of Mental Health, visited the program early in the Bronx when we had the first program, the first center. And we were told that it was really an excellent idea, that they saw how many girls were coming. But, they said, well, gee whiz, sorry, Rosa, but this is not an evidence-based program. So we have never really got any funding from the state. So we needed to become creative and to get these fundings. For example, let me tell you the story of how we opened the Brooklyn Center. I was in a meeting with Congresswoman Nydia Velázquez, and she said, Rosa, you have some nerve. How could you have opened a center in the Bronx and you didn't open a center in Brooklyn? And I said, Congresswoman, there is a need in Brooklyn, but I don't have the money. Do you have the money? And she was very supportive, and indeed, we were funded in Brooklyn by the Congresswoman Velázquez. In 2019, we were able to open the Queens Center because basically a council member asked us how come we were not in Queens when there was so much evidence of the need in Queens for Latina adolescents. And again, I said to them, well, I don't have the money to open Queens. And they said, well, we'll get you money. And we did open Queens in 2019. And the same story goes for Manhattan. We have a distinguished senator at the state Senate, Senator Luis Sepulveda, who regretfully lost his mother to suicide when he was 10 years old. And Senator Sepulveda said, how come you're not in Manhattan, Rosa? Look at the need. And I said, Senator, I don't have the money. So he managed to convince the mayor of the city of New York that we really needed to open Manhattan, and we got the funding for Manhattan. I don't have no way of saying that we could go to the urban areas. If there is a need, we will respond as long as we get funding. Next. So the remaining of my presentation, I want to talk to you about COVID. New York City had the worst of the peak and the epidemic. It was in March, the beginning of March and April, May. And we had challenges here. The number of residents of the city that were infected, the overwhelming situation of hospitals that didn't have no beds, and then the challenges of the Latino community. So basically, as of March 16, I refused literally to close the agents totally. I couldn't because I have 17 locations where I have housing programs, and we were identified by the governor and by the state as an essential agency. And I had no intention to close. Life is precious. So what we did was to do remote conferencing like we're doing today, using the technology to continue to provide services using Zoom to the Latina adolescents and their families. It was a challenge to get everybody with computers or iPads or telephones, but we were able to manage through the Board of Education. We make sure that the girls who were home attending school, that they got their equipment and that the mothers were able to use that. So from March to to today, we have done more than 1,500 case management sessions with the teens and their families. We have done 39 music therapy groups. And by the way, I did not really talk a little bit about the music therapy. This is a type of intervention for the Latina that have been very, very effective. And let's all remember whether it's the mariachis or the salsas or the merengue, that we all coming from different Hispanic, Latino background, that we love our music, and the music does have a meaning in our culture. It's not related to race, remember, it's related to ethnicity, to culture and group, right? So we have been able to provide the music therapy groups through more than 4 or 5 years. And actually, we do have a fundraising event, except for this year, that of course we couldn't have it. And it's a breakfast, and the girls have written the songs that they're going to present in the breakfast through the music therapy group. Very effective intervention, by the way. And they also, very effective intervention with the art therapy, including remotely. And actually, we're beginning to think of doing as an exhibition of the artwork that the girls have done through the COVID time. We have referred many of the families to food programs through Hispanic Federation. We were able to get 300 gift cards for families because basically this was one of their greatest needs. We offer 103 tutoring and SAT prep because we do believe that our girls need to go to college and they need to become the Rosa Gills of tomorrow and Dolcas and all of you participants. We cannot let our girls die. They need to play a significant role in the stage of Latinx in future come. And then we, interesting enough, because we do believe that this is a community-driven program, we did ask the parents, listen, we're working with you, we have case management services. We're offering English classes to the parents, and we asked them why. Why do you want to do that? And they said, well, you know, in order to get jobs, better jobs, we need to learn English. And they also told us that they really need to learn English to be able to go to mental health clinics and not to have to use an interpreter for that. We are trying to respond to their needs next. So this is just for you to know what the impact of COVID has been on not only on the Life is Precious family participant, but this is just a little bit of what's happening in the Latinx community in New York City because of COVID. Over 90% of the parents in the Life is Precious program have lost their job or have reductions in hours. 69% of the families are undocumented and cannot file for unemployment, neither they could get the stimulus check. So there was no income coming in for this family. And 100% of all the families experience food insecurity. That's why we try as much as we could, you know, to get them programs where they could get food, and also through Hispanic Federation to get them a little bit of money for food. It is sad to say that 10 families experience the loss of grandparents, aunts, uncles, friends due to COVID, and one of the girls lost her father. Many families are dealing with loss, grief, anxiety, social isolation, and depression. They're really terrified that they're not going to have money to pay the rent, and they're going to be thrown into the streets, and they're going to become homeless. And they fear that they cannot pay the internet connection, though interfering with the remote mental health therapy sessions that their daughters are receiving. The pandemic required that we rethink services. The monthly in-person parent group was changed to a weekly call, and we increased the number of case management sessions with the parents. And by the way, these have resulted in a much greater participation of the parents. We have 30 per call or even greater, and a greater willingness to discuss family issues. And we have learned in this parents group that, for example, the parents tell us how concerned they are because during this time, the mental health clinics have not reached out to them. They don't feel that the psychotherapists are involving them in the treatment of their daughter. They don't really know what the side effects of medications are. So, you know, this greater participation of parents have given us even a greater view as the, the discrepancies and the lack of cultural competency among mental health providers in the clinics in New York City. And as we speak, we have seen in the last week an increase in cases in New York City. And this is troublesome because we are all very fearful that the second wave will be back. And although the schools have been open and there is a choice for parents to, for the girls to keep the remotely going to school, or that they could go 2 days a week to the school physically. But they're very concerned, and we are very concerned because we do not feel that these girls are really getting the education that, that they need. Next. And those are 3 articles that we have published about the work that we have done in the Life is Precious program that perhaps, you know, will give you a little bit more information that I have been able to give you during this time. I just want to close my remarks by saying that I hope that there are many other communities in the country because the phenomenon of suicide among Latina, suicide behaviors among Latina adolescents is not only in New York City, and this is through the country. Thank you so much for having me here today. And again, my apologies for the technological problems here. Thank you.
Dr. Jill, thank you so much for this wonderful presentation. Kudos to you and your staff for sharing with us about Life is Precious, a very comprehensive prevention program. And the most importantly, I think despite the pandemic, you continue to provide Life is Precious. So in other ways, you bring prevention online, you try to find ways to make this work. So thank you so much for helping the Latino families and take the lead on this. I appreciate that. We have a few questions. The first question is, for example, we have here, why is bullying listed as a unique risk factor for the Latino teens?
Because the bullying has increased tremendously, and I would say in the last 10 years. This is something that before we didn't see it, that the Latina teens didn't experience it before. And what is concerning is that the bullying in terms of the families, how do they react to the bullying, and how do the schools react to the bullying? And I think that speaks about, you know, how do families address this issue with the adolescents, and how do they deal with it, and who do they turn to in terms of addressing the challenges experienced by the girls.
Thank you, Dr. Gill. The next question is, what can help Latino families to prevent suicide prior to children reaching the adolescence?
Great question. I always think that we always have an opportunity to learn more, and that our community and our families need to learn more, and that we can become instrumental in achieving that. I think that we all, or many of us in this presentation, know that to talk about mental health, enfermedad mental, often is connected with being a loca, which basically is not necessarily, I mean, we shied away from that. We don't want to talk about suicide because, you know, that means that, you know, you're not well in your head. Mentally, you're not well, right? So we need to begin to work with our families early, very early, that we have emotions as well as we have the physical aspect of our body. And we have feelings and we have emotions. And it's okay to be able to share what is really troublesome and bothering some, right? So to help the families to understand the value of emotional health and to be able to talk to them rather than waiting when the adolescent feels isolated. For example, I mean, there are symptoms that we know that are associated with suicide ideations and thinking, which is, you know, depression. The girls loses interest, they lose appetite, they cannot sleep well, so forth and so on. So the parents need to be in tune to this different way of behavior, and to be able to feel comfortable in saying, you know, what's going on with you? What is it, you know, you used to go with your friends, you don't want to go out anymore, you just want to sleep. So what it is helping our families to talk about mental health.
Thank you. And I think this is go along with the comments that Mireya have in the chat, but that say that most of these factors for suicide on youth Latinas is the stigma and the mental health.
Yes.
Especially if they are the first generation in USA.
No, we see more than first generation in USA. I think that in terms of sociology, we think that basically the first generation is the one who's having a challenge. Not necessarily so. We have seen, we have worked with adolescents who are not first generation families or second generation family. You know, one have to think, you know, how much does the cultural values remain in the way that we live and we think, but not necessarily we think that this is just a phenomenon that we see in first generations Latinx.
And the million-dollar question, Dr. Jill.
Oh boy.
Other organizations can replicate your program.
Well, we are, like I mentioned before, that we are pretty much committed to this research enterprise, because we do think that this is an area that we really need to develop and tailor programs to the culture of the Hispanic community, the families, and the Latina girls. Yes, we will welcome, I mean, we are waiting to see the results of the control groups. And we hope that we will be able to share, you know, the work that we have been doing with other communities. I do hope that there will be other communities that really will replicate this program. We can help them. Not necessarily we have all the answers, but we have gone through 12 years of work and modifying the program, learning more, involving the community, so forth and so on.
Thank you. We appreciate this presentation, Dr. Jill. Thank you so much. We would like to thank you for today's presentation, and most importantly, for all the invaluable work that you do for our communities. Thank you so much.
Thank you so much, and thank you for having me here, and my staff is very proud to be able to contribute a little bit to addressing the needs of Latina and families. Thank you.
Thank you. And with this, we conclude the questions. Here is our contact information. for the National Hispanic PTTC, please reach out to us for more information about the projects and request training and technical assistance. Also, we have the presenter contact information. So feel free to reach Dr. Jill and the Life is Precious program. Next slide. Here, next slide. Here are some resources for you to use in the future. So feel free to visit all the free resources that we are providing to you this afternoon. Next slide, more resources and more resources. Now, everyone, you will be redirected after this presentation to a different page to complete the evaluation. Please remember your opinion is important to us. Next slide. And just to remember that on October 15, please join for the next presentation about the last presentation of this series, titled Institutional Racism and Discrimination Impact the Latino Children and Youth Mental Health. The presenter is Dr. Rocky Romero. Please visit the website of the ATTC website and the National Hispanic and Latino ATTC and the National Hispanic and Latino Mental Health ATTC to register for this event. Thank you again. Thank you for joining us during this webinar titled Life is Precious. We appreciate your patience and have a wonderful rest of your day.